Hi, dear listeners, and welcome back to Blush and Bloom, the podcast where we talk about women's health, self care, and everything in between. I'm your host, Gigi, founder of Asale, your space for cycle aware and preventive care. I'm really glad you're here with me on this journey to unpack women's health and highlight the incredible things being built in this space. So let's get into today's episode. Okay. Hi, Uma. Thank you so much for joining me on the Blush and Bloom podcast. So, for people who are meeting you for the very first time, how do you introduce yourself and the work that you're doing?
So I'd say I'm a technologist at heart, but I'm also a realist. And for me, technology matters only when it makes somebody's life easier. So I'm not one of those people that is technology for technology's sake. It's more what is it capable of doing and how do you use it for everyday life. And in terms of my personal life, I am a mom and I have two beautiful kids. Well, technically, they're no longer kids. They're 20 and 22 years old. So one is an adult almost. And a lot of my choices and life choices and what I do on a day-to-day life is driven by how we've built our family and how our support system works. And as you know, I'm an immigrant into this country, so my support system matters a lot. And when you look at how Maarge is built, it's built with a whole bunch of people that I know from going through their life journeys and how health as well as caregiving has affected their lives, either positively or not so positively. So when I think about Maarge, I would say I'm thinking about it's something that I'm building that's a lot more personal. So it's a passion project, right? So you usually have a passion project when something affects your life in a deep way. And I would say my answer to that has been Maarge. So what does it actually do? So um, it helps people like me who are battling health conditions to kind of have a little bit of control in an area of your life where control is not that possible, because you cannot control what happens. You can possibly manage what happens, but not really control it. So how do you deal with that? That's where I started. So when I'm introducing myself, I'd say my goal was to fix a problem I had. But as I started thinking about it, I started realizing caregiving is going to become critical for me myself. And it is a stressful situation. It's overwhelming. It's overwhelming for the patient because they're going through tough times. It's overwhelming for the caregiver because when you don't feel good, you're probably not at your best. So you kind of snap at people. And so it kind of drives caregivers' stress levels as well. So when I look at what I want to do or what I would like to do, I'm looking at how would what I build help me as somebody who is having health challenges, and how would it help my children if they end up having to be in the same situation of taking care of myself, because it's about both of us, right? It's about the relationship between the two of us. That's what I would say.
Okay, thank you so much for sharing that. And it's incredible work that you're doing, that you're able to take your experiences and you're able to build out a platform and a community to support other women as well. So let's talk a bit more about you personally before we discuss your work at Maarge. So your work has spanned, you worked at IBM, Sybase, and now you're working in health tech. What pulled you in from enterprise technology into founding a women's health company?
I think if you go back to the first question, I'm never about technology for technology's sake. So when I was with IBM, I did a lot of implementations. I did a lot of work around strategy. I did a lot of work around services implementation. So taking IBM's products and installing it at customers and helping them use it in their processes. So when I got sick or I became unwell, I started thinking about, okay, how do I fix my problem? Right? It was that's where it started. Okay. It was never that I wanted to build a women's health technology company, or it was never, hey, I want to be an entrepreneur or something like that. It was more, okay, I have a problem. I don't know how I'm going to manage this problem. And so I started doing some research around, okay, is there anything around? Because, I'm lazy. I prefer to have somebody else do my work for me than doing it myself. So I started looking for stuff that would, that would help me, right? And as I started looking at it, I was like, okay, I can use this app for this piece of the puzzle. I can use this app for this piece of the puzzle. But at the end of the day, unless everything is in the same place, I couldn't really work with it, right? So it would be me taking a bunch of different exports from a bunch of different applications and then putting it into a spreadsheet. So we're back to having a spreadsheet and a Word document, and then you can mess things up. That's when I started thinking, okay, you know what? I need something that manages my stuff for me. And if it manages my stuff for me, because it is such a unique situation, it will manage stuff for other people. That's how the company actually, in my mind, that's how the idea formed. Then I went over, then I talked to a bunch of people because I love building stuff, but I cannot sit in one place and do the work necessary. So I needed help from that perspective. So I went and talked to a bunch of friends and I said, hey, this is what I'm thinking about. And the initial reaction was, I don't think so. That's too much work, right? And then about 6 months later, as I was already trying to figure out how I'm going to manage my problem, one of my friends came back and said, you know what, that idea that you had actually does have legs. So why don't we actually think about it? And today he is my co-founder. He still is. So that's the biggest reason why it started. The other angle, if you think about it, is I have a lot of friends who do not have the best physicians, primary care folks that they talk to, in the sense that they don't have the time and the energy to spend on the problem. So nobody has a holistic view of, hey, this is what's going on with you. Luckily for me, I have a spectacular primary care physician. So the other angle I was also looking at is, what if you don't have that luxury? What if the person that you're working with is not attuned to what you need or what you want or what can help you? So how do we address that? That's how how it started, the journey started.
Okay, thank you so much for sharing that. And I really appreciate the context. Also, moving on to the next question now. You are a two-time breast cancer survivor, which is incredible. And you've already talked about how your professional life has influenced, your personal experience influenced building Maarge. So can you tell us a bit more about how your journey through this, your treatments and everything also influenced how you're building up Maarge as well?
Yes, I am a two-time breast cancer survivor. And to be perfectly honest, when I first got diagnosed with breast cancer, this did not even, occur to me, right? I was young and I was like, I'll fix this. This is not a big deal. It's just a blip. I'll go past this, right? And so at the time, as any young person who gets news that doesn't really match with their expectation of how their life's going to go, I was the same way. I was like, damn, this is putting a, crink in my neck or in my step, and I got to figure this out. And so I jumped through and I started, working on getting healthy, working on doing this, working on doing that, so that I could get back to work as soon as possible. So I was back to work within 2.5 weeks of me, after I got the diagnosis. I got a lumpectomy done. So that entire period was, once I got the diagnosis, it was just like, okay, what do I do next? So once the surgery was actually scheduled, I was like, okay, so how long is my recovery period, right? So during that recovery period, as soon as I was able to run, I was like, okay, I got to get out of here. Because for me, it was a way of fighting it, right? It was a way of fighting something that didn't go the way I had expected it to go. So then I went in for radiation. And again, it's the same thing. Luckily for me, I did not have to go through chemo. For radiation, radiation is a 6-week process, right? You go in every single day, whatever it is. It's debilitating. It's very, very difficult. And at that point, we're talking almost 15 years ago. They had just come out with, targeted radiation. And now technology has improved a fair bit. So with that targeted radiation, you only go in for like 5 days, but then you have the same effects as if you were going into radiation for 6 weeks, because it's a controlled release over a 6-week period. So physically, you don't really have any difference per se, but from a time perspective, in 5 days, you're done with the entire process of going in, getting done. So I looked at, so for me, that was okay. It was done as soon as the 5 days was done. So then you have the fatigue and everything else. And that's when the management comes in, right? Okay, I'm not going to be, I don't feel great after like 2 in the afternoon. So I got to get all my work done from 8 a.m. to 12 noon or something like that. So so that was the first part. And then like few years later, I started having, side effects. I don't know if they're side effects or if they're orthogonal problems, right? So I started having huge neurological issues, which nobody, even to date, has been able to figure out why, right? So at that point, it went from it's just a fatigue problem to, this is a much larger problem. And the issue was that I would be perfectly fine for, 6 weeks or so. And I would, you have fatigue, which is fine. But then at the end of 6 weeks, all of a sudden, it'd be like a volcano. I would be curled up. I can't get up. I can't do anything. I wouldn't be able to communicate well. My kids would go like, Mom, you're not making sense. You're not, so at that point, I started to, and the MRIs showed there was a problem, but it wasn't a stroke. So you're talking about, going every 6 weeks to get an MRI or get something else, and nothing was being figured out. So at that point, that's when I started with, okay, this is not something that is run this test and this will happen. So this is a consequence and blah, blah, blah. It was more of a chronic, something's happening with my system, so I can't, so this is going wrong, right? So that's when I started tracking, right? I started saying, okay, what happens? Like, I started kind of at least mentally figuring out, okay, this is a flare situation. So what was happening the last few days or the last few months, sorry, the last few weeks? And then you go, okay, so then I started being able to, on a personal level, say, okay, A, B, and C happened. So I think the consequence of that is I'm going to go fall sick completely, get out of control. So that means that starting, like 24 to 48 hours after A, B, and C happened, this is going to happen. So that's when the idea came up, like, okay, if I can figure out that there is a pattern and I can control that pattern, then there's a possibility that I will not have the flare, right?
Yep.
So I went from being Mount Vesuvius, like you go 6 weeks, boom, 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 and then go poof, everything blows up, to more of a gently rolling hill. Oh, A and B happen, so I have to make sure somehow C doesn't happen. So I can then control what follows up, right? So that's how the app started. So now if you look at the app, in our app, I look at, okay, I provide a template that says, hey, what are the A, B, and C things that could affect the flare? So, and it's different for different people, right? For me, it was basically if I stood up in the morning and I closed my eyes, I wouldn't find my center of gravity, right? I would literally tell my kids, okay, am I swaying? And they'd be like, oh, Mom, you're swaying like crazy. Or they'd be like, oh, no, you're stable. So that was my first indication that something was going to happen. Now, not everybody's going to have the same problem. So then I started thinking about, okay, if I built a tracking app, how would you do something where people can put in their own set of things that they track and say, these are the things I want to track. And you don't even have to track it on a day-to-day basis, right? You don't even have to. So one of the great things is you can say, these are the things I want to track, but you don't have to have a schedule for it. You can keep it in your checklist. And when it happens, you can say happened, right? So that itself gives you a pattern. So that's kind of how, if you want to know how my app was driven, that was the driving. Right.
Okay, thank you so much for sharing that and for sharing how your personal experience tied into building out the app. Okay, so a lot of health apps only focus on the patient. Why is it important for you to design Marge to include caregivers and families as well?
Okay, so if we go back to the story I just said, right? So the worst case scenario in this situation is you could end up with dementia. The best case scenario is you kind of keep going and nothing happens. I started in my mind, starting to think about today, I'm still mentally extremely capable. So when I go to see my physician, my neurologist, my cardiologist, I can tell them, hey, A, B, C, D, E happened. And they now have a way to actually give you a way to deal with it, manage it, right? So in most situations, unless it's something that's a test can prove, doctors are making a guess at what the situation could be. Now, this provides them with a way to do a scientific wild ass guess, is what I call it, right? So now, if I take myself out of that situation, if I say, okay, Uma's no longer mentally capable of having this conversation with the doctor, I would want my husband or my kids to be able to talk to the doctor and know, okay, this is what's going on. The only way to know that, that means that puts them into the caregiver category. And so it kind of drove, okay, what would my kids want to know about what I'm going through so they can have a conversation and help me be as normal as possible, right? So at that point, I started thinking about, okay, unfortunately for me, I had a friend who got diagnosed with ALS, and she had a lot of doctor's appointments and stuff like that. So I started putting myself in that situation and said, okay, what would happen if my daughter had to hand over to my son if they're swapping caregivers, right? How would they do that? So she could say, hey, mom has an appointment with the primary care physician, but then my son has to know who the primary care physician is. Or another situation is, let's say, recently happened to one of our own folks, is my team actually is all people who are very, very much involved and very interested in making this successful, because they all have their own stories of caregiving. They all have their own stories of having to take care of their loved ones. And so we're all kind of looking at it from, okay, if I'm in this situation, how am I going to fix it, right? What are the things that are missing? So what we started off was bare bones. Okay, you have a plan, track it. Then we said, okay, what if there are medications? What if you need to handle multiple people giving medications at different days, at times during the day, because you can't be the same person? Then we said, okay, what if somebody who doesn't know your schedule, you tell a friend, hey, take my mom to the doctor. How would they know? So once we started looking at all that, we started looking at putting all of that information in one location. So at one shot, you will know who the doctors are, who's your primary care physician, who's your cardiologist, what appointments do you have. So your checklist shows you, these are your appointments, these are the medications you're taking, this is what you should potentially be tracking. If you go into the person's actual profile, you will see who are the doctors. If you're going for an appointment, what appointment is it and which location are you going to? What prescriptions is the person taking? So, for example, if you go into the emergency room, I've done this twice now. So when you go into the emergency room, they're asking you all these questions and you're like, yeah, I know that answer, but for some reason at the moment, I can't really tell you that because I can't remember, right? So it would be great to have, and my PCP, who I talk to a fair bit about this app, and she really loves it. She goes, Uma, you should say, I want to see your Maarge record. That should be your goal in life. When somebody goes into a hospital, they should say, where's your Maarge record? Because that would show them who your physicians are in case there's a complication, who do they have to call to find your history, what your prescriptions are, what allergies you have. And some of this is done on the other side. Like if you look at My Health that Stanford has, or My Health One that Good Samaritan Hospital has, or Bass's Medical has a different provider. I have doctors from each of these, right? And I have visit summaries from each of them in different locations. Doesn't help anybody, or doesn't help me if I'm in an emergency situation. I want all of that about me in one location. So if I have an emergency, everybody knows what's going on, right? So that's how the technology has been built. And that's how we're trying to solve it.
That's just incredible. And I loved that your friend also suggested using the name of your company as a verb, like Google things now, and then
Exactly.
that would be so cool. Okay, that's very incredible work. Okay, so how did your background in fraud analytics and cloud and enterprise system influence the way you're building out Maarge right now?
So Maarge is very data driven, right? So I don't know that it's directly related to what I did before, but it is orthogonally hugely related, right? So,
Yeah.
what is fraud analytics? You collect data about something. So, let's say you're trying to figure out if somebody's committing fraud, right? So, you go, okay, this person always gets $1,000 in their account on this day, but they don't have a job. But then right before they get the $1,000, maybe they call this person and then that person has put $1,000 in some other account. So maybe, so you start to find connections, right? So
Yeah.
you're trying to find a connection and a map to say, how did A relate to B, relate to C? And if you look at it as a whole holistic picture, how are A, B, and C related and what is the consequence going to be?
Mm.
Right. I remember looking at Walmart's shopping. There was a pattern that they had where there
Yeah.
was a shop. There was a problem with somebody stealing from them, right? And I remember sitting in a I was working with IBM at the time, and I remember sitting in a old joint late at night. It was the only place open in I think it was in Arkansas, where their headquarters is. And we had a presentation in the morning at at 8 a.m. or 9 a.m. And they'd given us this data, and I'm sitting there going, "There's got to be something here. There's got to be something here." And we presented the next morning because I found it. I was just basically, it's about, okay, who's connected to who, what transactions happened, what was the timing between the transactions, stuff like that. So we presented and everybody went quiet because they hadn't actually figured it out yet. So take that to your health, right? When I talked about managing it, I started tracking. I said, okay, if when A happens, then B seems to happen within 48 hours. And then when A and B have happened, then C happens. That's a relationship. So we can actually do that with your own health, because every action has a consequence, right? So when you are dealing with unknown consequences, the easiest way to do it is find a pattern. And that's how I would say that actually helped me in kind of figuring out if we can figure out patterns. Now, that said, I don't want people to worry about, oh, what is the privacy of this thing, right? We are HIPAA compliant. We do not use your data for anything. So what I feel what we is to provide you with a way to find those connections in your own data. So maybe give you a tool that says, okay, now run this analysis on your data and see if there's a consequence, there's a pattern. So that's, I think, how I would say it does. My background has helped, right? And then the other part of the background that helps is things take time. When you are trying to build a startup, you can't just say, oh, I'm done, I got to go find somebody, right? Everything takes time. So the patience and the diplomacy that has to come with the patience has also, being in large organizations and being in these situations, has helped. Finally, with cloud, I started working on cloud. I'm probably going to date myself, when cloud was not called cloud. So I was one of the first few evangelists for IBM in the cloud technology space. So I used to do a lot of work with that. So when I was looking at this, I started thinking about, how would, instead of having the app save the data locally, how would it be much more wouldn't it be much more helpful to just host it as a SaaS enterprise, right? As a SaaS app. That way, everybody who's involved can look at it. And, these days with iCloud, that's like ubiquitous. So I had a background in that, so it makes it easier.
Okay. Thank you so much for sharing that. And you're basically like one of the pioneers of cloud. That's so cool. One of the very early users of cloud before cloud was called cloud. And I think like that was probably around the same era when before AI was called even AI now.
Yep.
Like,
Yep.
yeah, that's so cool. And I love that your platform, something that it reminded me of was in some of the conversation on the podcast we've had, spoken to people about how best women can better advocate for themselves. And I believe that Marge is going to support women with doing that because the responses I usually get, like, how can women better advocate for themselves is with data. And if you have the data and it's able to connect different touch points that you've had with so many doctors and all these records are in one place, I think it will help several women be able to be better prepared for each doctor visit and better have more productive conversations. It's very impressive work. Okay. And my next question.
Okay, sorry to interject. One of the things I will say is one of the folks that is using our app not regularly, to the extent that people are regular in tracking themselves, actually called me a few last week or a week before that and said that they were able to use the tracking data to get their doc to understand that there was really a problem. And they, as such, because of the data that was available, the doctor was able to prescribe follow-on tests to make sure that they would find at least what the source of the problem was. So yes, that is one of and the statement that was made to me was, I know it's not easy, but the reason you built the product is in fact working to some degree. Just as a point of, it does happen. And women's health, if you think about a lot of women, when you look, I don't know statistically what the numbers are right now, but before breast cancer, before mammograms became required for women over the age of 40, before that, women would go in and say, hey, I have this problem. And they would be just told, like, no, it's just in your head. That's not a problem at all. Then come to, like a couple of years later, here they are, stage 2 cancer, and they could have been caught a long time ago. We, we tend to get, I don't know that it is done intentionally, but I think the problem is that there's not enough data around how women's bodies react to go through that. So that's, I think, so this will help tremendously when you go to your doctor and say, no, this is not in my head, this is actually happening, and these are the dates it happened on, kind of stuff.
Yeah. Thank you so much for sharing that. And it's wonderful that your people using your platform are already reaping the benefits of having everything in one place and be able to find this pattern. So that's really impressive work. So from your perspective, where is digital health getting things right, and where do you think it's falling short?
So that's, that's an interesting question, right?
Yeah.
Because we are literally at the very, the bar is so low right now that you could just trip over it with anything, right? So from a what are you getting right perspective. So a lot of work is being done around using it for MRIs, for studying the images, stuff like that. And I think that's spectacular, because what would take you a lot of time, they can the computer can do it in the background really, really, really fast, right? And they can come back with, oh, here's the possibilities. I think where we have an issue is if you don't use it as an augmentation, if you don't really still have that radiologist or your physician or neurologist or whoever looking at it and saying, oh, based on my experiences, just quickly recapping what I said, I think it's great for augmentation. I think it's and it's great for simple things that are happening to people, right? So if you have the flu, I don't see a reason to go into the doctor's office and say, hey, I have the flu, and then they give you a medication and then you come back and take it. Whereas for complex things like people who have lupus or people who have the tick, what is it called? Lyme disease. It's not something that is easily detectable. So looking at the person in person does make a difference. So I think if some digital health is pushed too much, I think we will lose trust, right? That's kind of, I think, where it is. So, much like any technology, when it first starts, everybody wants to jump on the bandwagon and they want to use it 100%. But maybe you need to be more nuanced about how you use it. I think that's the biggest issue that we have, in my opinion. I love it when my doctor says, hey, I have an AI note taker, so I'm not missing anything. No problem for me, right? It's awesome. A couple of my providers actually use AI notes takers when I'm in the meeting, so that their after visit summary actually reflects exactly what we talked rather than just what they remembered we talked about. So I think we're getting slow steps where people can start getting used to the idea of having having something else. I think would be a good thing. If we make it 100%, digital, then I think you're going to have a bigger problem there.
Okay, that I think that ties into the next question I was going to ask you about your thoughts on AI, and I think you basically covered it because again, like you said rightly, that about trust and maintaining that, and I think that's a topic that comes up a lot in the podcast when I ask what women founders should prioritize, and it's usually around building trust and maintaining that credibility when you're building out your platform because women's health has been not treated as it ought to be. And then it's very important for the users to be able to trust the information that you're dishing out. So thank you so much for sharing that. And okay, so I'm going to move on to another question. So what do you think health tech founders often misunderstand about women's health? Like, say, for example, if FemTech founder doesn't particularly have this experience, but she's building in the space, what's something that she should prioritize?
If so, health tech founders, so there are two things there, right? So if you're not building it for yourself, that means that you are seeing a gap somewhere, which is why you're thinking about building something. So I think the biggest focus should be, especially in health tech, it has to be around, okay, what is the gap and how are we fixing that gap? When you talk about FemTech, which is just women's health, right? I think I was thinking about this last night. And actually, thank you for asking these questions because the thing is that I have this analogy when I talk to people a lot. I say, okay, what's a handicap in golf? Right? You say, okay, for these two people to have the same set of output, same outcomes, one person needs 3 shots, one person needs 6, which means that this person has a handicap of 3, right? In simplistic math. I'm sure it's a lot more complicated than that. I'm not a golfer, so I can't tell you that, right? But the thing is, the handicap essentially gives the person who is not as experienced the ability to compete with the person who is very experienced, right? So I'm assuming that's how it works. At least in my head, that's how it works. So,
Idea.
so what I think is with health tech and especially with women's health, I think that women should have a handicap, right? So, what do women normally do? They are usually the caretakers in the house. They, even if they are working, they're the people that are doing all the majority of the work around the family, stuff like that. And so to keep that going, they end up also not really giving something the kind of priority that it requires. So, for example, you ask a woman, okay, on a scale of 1 to 10, what's your pain level? They're more likely to say it's a 4, 5 or less, because they know that if you say it's more, the other person's going to say, then you shouldn't be doing this, right? So I think when you're thinking about women's tech, when you're thinking about health tech in general, you need to give them the handicap and say, okay, what's a 5 for a woman is technically a 7 in reality or an 8. So give it the handicap, add the percentage to it to say, okay, generally women tend to do this, so we're going to add this to make sure we give it the right priority. So when you're looking at working with health tech, also that kind of thought process has to go in to say, okay, when I'm talking to 10 people about a problem, guaranteed 3 to 4 of them are going to say it's not a problem because they want to fight it. They don't want to say, hey, I have this problem. So that's kind of where, the founders should put some effort on to say, hey, how do you fix this problem?
Okay. Thank you so much for sharing your perspective on that. And moving on to another question. So you've worked across 2 worlds. You worked in Silicon Valley and IBM for several years, which is so cool. And now you're working on Maarge. And I think I skipped a question. You also have a platform called My Caregiving Ally, if I'm not mistaken. So you're working on these platforms now. So how, okay, sorry, my brain is glitching. It's late in. Okay. So you worked across Silicon Valley and now you're building your own companies. So how do you balance the speed of innovation with building for trust and empathy? Because I think we discussed earlier, these are very important aspects for femtech products. Whereas I think in Silicon Valley, the idea is to break things and move fast.
So, IBM bought the company that I started with. It was called Crossworld Software. I was one of the first few engineers that were hired there. So in software. And at the time, today, when you go into systems, you kind of go look at, hey, you're looking at your customer record and you want to see what your invoices are, and you click on it and you see a list of invoices. It's integrated. In those days, in the early, late 90s, it was not so. It was, you'd have a healthcare system, you'd have a customer system, let's say that's Siebel, you would have a HR system, let's say that's PeopleSoft, you would have a billing system, which is, let's say, SAP. You have three different systems. They never talk to each other. So essentially what you were trying to do is integrate and say, okay, if you're the customer and you're asking me what invoices I have to have a way to connect you to my SAP system so I can give you the invoices that I gave you. So it's an integration problem. And I know that it took us a long time to prove that that was essential, right? When you look at healthcare, when you look at what we are doing today, it's exactly the same problem. I have my records with My Health on Stanford. I have my records with My Health One on Good Sam. I have my records with something on Bass Medical, and I'm looking at three different things. And my feeling is, okay, if I put all of them in the same place, then it'll be good. So there is speed of innovation. So speed of innovation could just be the thought, right? Okay, how do we get this to work correctly? So from an innovation perspective, I look at it that way. The other thing is, a lot of what I'm building is not really rocket science, right? So you're trying to put together something that makes it useful for a person who is not in their best health, right?
Mm-hmm.
It could also work perfectly well for somebody who is in their best health. So if I'm a really health conscious person and I say, hey, I want to keep track of how long I walk every day, how I'm sleeping, how I'm doing this, great, right? It will work for that person. But for the person that is not helpful or not healthy, this is a lifeline, right? Knowing exactly what's going on. True story. When my mother-in-law was living with us, she had so many medications she was taking. She was taking a lot of medications. And we had told her, okay, you can no longer live by yourself, so come live with us. And she would literally crash through. She would fall multiple times, right? And every time she falls, we'd go to ER. So every time we go to ER, they note that an older person came in and she fell. So this happened 3 times. And then the 4th time I got a call from the social worker and said, hey, we are worried about elder abuse. So we want to come and talk to you. So I'm like, okay, be my guest. Come on over. So they come to the house and we have this long conversation sitting at my dining table. And I just bring the entire prescriptions that she was taking, put it on the table and said, okay, you guys do not even know what prescriptions she's taking, which is all basically causing her to be unstable. And I can't tell you not to prescribe that, but you should know that you're giving her 7 different medications that do the same thing, which means she's getting overdosed. So I said, okay, now you tell me where the elder abuse is coming from. Immediately the conversation changes, right? And they go, oh my God, we got to do this. I said, yes, please take her off of all of the medications so she can then be on the minimum number of medications. This happens to a lot of older folks because they're going to different doctors. Each doctor, they say, hey, my foot hurts. So that doctor gives them a medication. Let's say they give them oxycodone. They go to another doctor. They go, oh, my chest, it hurts like crazy. So that person's given them a medication. Now you have 2 doctors who are giving them the same medication, but from 2 different systems. So nobody knows. So all of a sudden you're getting double dosed. So that's why this is a problem that exists. It's not rocket science. It's just a consolidation effort of saying, what is Uma doing right now with her health? What are the medications she's taking? Then the next step would be, in my mind, through AI, I can say, given the list of medications, go see if there's any contraindications for taking multiple medications of this sort, and then give them a note that says, go talk to your doctor because you may have a problem. Right. And I think so that's the innovation part of it. The innovation part of it is bringing everything together. But the speed of how we get it to market, our product, we've been trying to get it out for now a little bit. Right. And part of it is because I'm the one driving it and I'm not healthy all the time. So when I'm not healthy, we kind of do what we've already planned on doing, but then nothing else further than that can happen. When I talk to people and I say, look, it's taken a long time because it's built for me as a primary patient, and that kind of builds the trust. And when I talk about, and I know that this may require caregiving, so we've also got the platform that does the exact same thing, but from a caregiver's perspective, that builds even more trust, right? And the empathy, because now they recognize, okay, I understand there's a problem with caregiving as well.
Okay. Thank you so much for sharing that. These are very in-depth responses. All right. So we are headed towards the end of the podcast now. So I have a few questions left. So if you could leave one message for women who are listening and who may be navigating cancer right now, what would that be?
So the thing that I would tell them is the odds are with you. So nothing's going to happen to you. You are going to live. You will survive, right? It's not going to be easy, but you're going to survive. And given how fast cancer research is going forward, you're always going to be one step ahead of it, right? So you're going to be able to get the latest treatments and get everything for you so you can continue to live. Your goal should be, how do I live, and what is important to me? So your perspective needs to change from where you are today to saying, okay, I'm going to beat this stuff and I am going to survive. So if I'm going to do that, what do I want to do? So I really love, I don't know if you, I don't know how old Rachel Platten is, but I really love her song called This Is My Fight Song. And whenever I'm down, I always listen to it because it's like, okay, this is my fight. And when when I'm in the car and it comes on, literally, I find it very helpful for me. So listen to that song. That is you. You are your own hero. Make the best of what you got and you'll beat it. So you'll beat the odds. So that's what I would say to them.
All right. Thank you so much for sharing that. And I'll also include the link to the song in the podcast description and in the show notes. Thank you so much for sharing it. And okay, so final three questions. So what's next for you and for Maarge? Are there any features or partnerships or goals that you are excited about?
Well, features I'm excited about obviously is once people start using it and have enough data for me to be able to provide them with those tools where they can try to start looking at patterns, right? That would be a big, big thing for me. In terms of partnerships, we are in the process of working or talking to folks that support people with cancer, like Cancer CarePoint or organizations that do work that are nonprofits that work with them. Anybody who's also working with in-home support services, right? So people that go into the house and provide, the counties work with folks that are disabled and have caregivers. And most of those caregivers are family caregivers. And if you are listening to this and you are one of those people that is, involved with either a nonprofit that helps people with chronic conditions or helps elders stay at home, aging in place folks, I would love for them to, for you to call me. You can reach me through hello@maarge.com or uma@maarge.com. Both of those would work in terms of getting in touch with me.
All right. Thank you so much. And I will include the emails and everything as well for people who want to easily reach out to you. Then, okay. So my favorite question for this podcast, what would you tell 15-year-old Uma?
Actually, this is the one that, I'm glad, you sent some of these questions over to me. And I was thinking about it last night and I was thinking, what was I doing when I was 15? And I was taking care of my mother full time at the time. She passed away when I was 15. And I haven't thought about it in 40 years. So that kind of put me back. And I started thinking, you know what? Ultimately, it all comes back to your experiences. Okay. So I'd say, my caregiving ally was probably that. So I guess I'll tell my 15-year-old self that things work out. You'll be fine.
Okay. Thank you so much for sharing that. Okay. So final question for people, you already mentioned this, but for people who want to connect with you and your work, where can they find you? You already mentioned your email. Maybe there's website, LinkedIn.
Yeah, so we have mycaregivingally.com. We have maarge.com. And, we are in the process of trying to get involved in the social media space. I do have a LinkedIn profile. You can find me under Uma Subramanian SJ. That's my, LinkedIn./IN, whatever. And I think I can send you, links if you want to include it in your podcast. That would be great.
Okay. Thank you so much, Uma. It's been wonderful having you on the Blush and Bloom podcast. Thank you so much for sharing your experiences, building what's it's like building Marge and the idea behind it and what you've been able to achieve so far. It's really incredible work that you're doing.
Thank you. Thank you for your time. And thank you. I feel very special. I've never been on a podcast before. Thank you. Thank you so much for your time.
Thank you too. Hi again. Thank you so much for listening to this episode of Blush and Bloom. I'm so glad you joined me for this conversation. If you found it helpful, please share this episode with a friend or someone who might need it. Let's keep talking about women's health and working towards better outcomes for all of us. You can find more episodes and resources at www.asale.tech and check out our app at www.asale.health. And you can follow us for more updates on Instagram at asale.tech. Until next time, I'll see you in the next episode. Take care and bye-bye.